Spinal cord injuries are very common and can make rehabilitation hard due to limited mobility. Although recovery is very difficult, it is essential for the body's health to be able to bounce back to normal activities. I'm going to talk about some exercises individuals with this kind of injury can do and how to modify the activity to fit their unique needs. If the patient is in a wheelchair, unable to move their lower extremity, then you can prescribe the patient to do more upper extremity movements instead. It is crucial for the individual to be able to maintain core strength. Therefore, one exercise that will improve the abdominal muscles is called the seated side crunch. I will now demonstrate how to complete this exercise. So while sitting in the wheelchair, tilt your upper body to one side, making sure that your lower body does not move. Like this. Hold for 5 seconds, then return back to the center of the chair. And then repeat to the other side. Hold for 5 seconds, then return back to the center of the chair. It is good to have the individual start with 2 sets of 5 reps and then increase as he or she becomes stronger. So I will demonstrate this one more time. Hold for 5 seconds, then slowly return back to the center. Hold for 5 seconds, and then slowly return back to the center. For this exercise, it is important to engage your core. Another exercise that I am going to talk about includes resistance, called shoulder extensors. This activity is for patients that have less mobility but can still move their arms and their shoulders. I'm going to be using a resistance band to demonstrate this exercise. So while sitting in the wheelchair, you're going to grab both ends of the resistance band with your hands, keeping your elbows down by your side. From there, you're going to slowly pull apart the band away from your body and then return slowly back to the starting position. Another way is to extend the arms above your head, keeping your arms straight and pulling the band apart away from the body, and then slowly bringing the band back together. And then one more way is to extend your arms straight out in front of you. I'll turn to the side so you can see a little bit better. And then you're going to pull the band out to the sides and then slowly bring it back together. It is good to have the individual start with 2 sets of 5 reps and then increase as they get stronger or decrease if it is too hard for them to complete. So I will complete 5 of these in a row so you can see what I'm talking about. So 1, 2, 3, 4, 5. Above your head, 1, 2, 3, 4, 5, and then out in front, 1, 2, 3, 4, and 5. Thank you for watching my video, and I hope you learned something new on how to modify exercises for those with spinal cord injuries.